Hi guys, it's me Hunter and I am back for 1 year anniversary. I know it's my anniversary, but it's also my anniversary. So yeah, it's been a full year and I just want to say hello, good to see you again, and I'm going to report any changes for my full year anniversary. And I don't really have a lot of changes. It's basically the same thing. Um, Probably in a month since my last video, I may have some voice drop. Some voice drop. I may have a voice drop. Right here. A little bit of voice drop. I always have a little more hair, especially on my legs for some reason, which I'm not going to show you, but I do have a lot of hair on my legs, front and back, top and bottom. No hair on my feet. I don't know why. If you guys have hair growing on your feet, tell me. Tell me all about it. Put it in the comments below. I wanna I wanna hear what you have to say about what's happening with you in your 1 year anniversary. If you're F to M, and if you're male to female, tell me about what your changes are too. I'd like to know what kind of changes you've had in a year. It's a full year. I'm a year older too. I just had a birthday last week. So hey, well you know, gotta get older. Y'all gotta get older. Can't help that. So, let me see. Well, I just talked to my pharmacist today, and they're just now telling me they've been prescribing me the wrong needles. Can you believe that? Prescribing me the needles to inject into my leg instead of my stomach. Intramuscularly, I don't know why they did that. I've been using the wrong needle the whole time. Ouch, I don't know. It hurts a little. Not a lot. Nothing to worry about. If you're afraid of needles, just go sub-Q. You could do that or go on the gel, which I wanted to go on the gel, but my insurance didn't want to pay for the gel. It just really, it supposedly costs a lot out of pocket. I don't have to pay out of pocket. My insurance pays for my testosterone. And now, I told them the bottle looks a little different than last month's bottle, and they said, oh well, we think we're giving you the wrong. We've been prescribing you the wrong stuff. I'm like, what do you mean the wrong stuff? Uh, and they said, well, we've been prescribing you testosterone for intramuscularly, so to go into your muscle instead of your stomach. I don't know what that's done. I mean, if anything, they're so stupid sometimes at the pharmacy. I mean, it's been a year and they've been prescribing me the wrong stuff. I mean, the doctor prescribed me the right stuff and they give me the wrong stuff. It is testosterone, obviously. Look, I mean, I've got a low voice. I've got I've got a beard, and I've got muscle gains. I have no idea what they're talking about. I might have to call them later today. When the owner, he's usually there, but he's not there right now. So when he's there, they're supposed to call me. If they don't, I'm going to call them back and find out what the hell is going on. You guys give me the wrong needles and give me the wrong testosterone. I mean, isn't testosterone testosterone? If you know any different, you guys put that in your comments below. Say, it can be different if it goes into your muscle. It could be thinner, I don't even know, thinner juice, thinner hormones. We're talking about my pharmacy. They usually pretty good about everything, but they just weren't today. And I noticed when I got my prescription today that it said intramuscularly, and I thought, why does it say that? I mean, I don't take it in my muscles. I take it in, I injected my stomach, sub-Q. And they said, oh, it might be a mistake on the label. Let me call your doctor. Then they call my doctor. Then they call me back and told me, no, it was the wrong stuff. And I don't know what they're talking about. So they have new employees there too. I don't think they know what they're talking about. I'm not going to give myself a shot today with the new medication in case it is the wrong medication for me. I don't know. But today's my shot day, and I'm going to be taking a shot later if they can get their shit together. That's the only way I'll take it. And I don't want to be behind. You don't want to be behind on your hormone therapy because your pharmacist can't get it right. Um, so I don't know. I mean, it does look a little bit in the bottle, in the vial. It looks a little bit thinner, and the vial's bigger. So I think they just made a mistake, maybe just this one time. But to tell me, oh, this whole time you've been on the wrong stuff, and and your needles are too big. Jeez. Uh, well, and then they said, you're not just sticking the whole needle in you, are you? And I said, well, yeah, I'm sticking the whole needle into my stomach. And they said, oh, maybe just put half the needle in. They don't know what they're talking about. Put half the needle in. Yeah, right. I just stick the whole thing. That's what I've been doing. So if they want to give me, and they said, well, maybe we can cut down on your cost of needles by giving you the right ones. Gee, you think if they cost less, that you should owe me some money? Of course, they're not going to back pay me for a year's worth of needles. Damn, I don't know. Anyway, so this is my year anniversary. I'm just the changes are just a lot of hair, voice drop, bottom growth. What else? Oh, my hair on top of my head is like starting to fall out. Well, it started on the ninth month of being on T. I noticed strands of hair all over my shirt, all over everything actually. But it wasn't real bad. But I thought, maybe this isn't. My hair is getting longer, and when my hair grows long, I do start to thin out. My hair starts to thin out even before I got on T. Yeah, of course, when your hair gets longer anyway, you have hair follicles, so that start to loosen up. If that's being, the gravity will pull when your hair gets longer. So if you want, if you don't want to have long hair because you're afraid it's going to come out sooner, just get your hair cut. Get your hair cut short. I mean, I might get my hair cut short. It just really depends. I'm sure it will help me look more masculine if I get my hair cut short. But if I go bald, God forbid, I have to wear a hat all the time. I've seen some guys do it. I mean, cis guys do it all the time. They'll just put a hat on, or they'll just leave their head bald, which I don't think I would look that great with a bald head, to be honest. And I've always liked long hair. I was around in the 80s when guys had long hair, and I used to go out and drag. I'd even do drag shows. I did a few drag shows back then. I don't think I mentioned that before, but I don't know. I did say I was a Charlie Chaplin impersonator, and that's a bit of drag. And no one ever thought I was female. I passed pretty well, pretty good. So but yeah, I would have the long hair when I do my drag shows, long hair, and then I would use mascara to fill in any vellus hairs that I had, my mustache, and then I have to kind of practically grow in, like like draw one in, make it look like it's grown in, like right in here and there, and I would pass. And I got my friend to go out, and she didn't even she's not even transgendered. She just wanted to go out and have fun with me, so she's really feminine too. But we had fun. We'd go into bars and get kicked out because we looked too young. Even we thought, well, we look older. We got a beard, but they'd laugh at us and just say, "Are you 18?" and things like that. And we'd always say, "Oh yeah," and they'd ask for our ID, and we'd say, "Oh well, we forgot it at home." And the next thing they say, oh, "We'll have to ask you to leave." And we just say, "Okay, so we can't have a beer." No, we can't have a beer. Yeah, and I used to um, do some drag shows, and that would be in West Hollywood, where I did some drag shows, and I can sing, but I was just mimicking to the songs, so that was always a lot of fun. It was always a lot of fun. So yeah, I did that. So yeah, I just like having long hair, and whether it makes me look more feminine, I don't know. Probably does. Um, I usually just put my hair back and wear a cap anyway, so I don't get misgendered. But now with the masks, now that we have to wear masks, I've been misgendered twice wearing the mask because it doesn't show my beard; it covers my beard. Hmm. So I don't know. I think what what can make a person look more feminine is probably besides their hair, their skin or their eyes, something like that. Um, I don't really know. I mean, it could be like your face is more triangular looking or in shape. Um, I know my other doctor was trying to figure that out too. She said, "Well, you don't look." She told me she didn't think I looked feminine because I told her I got misgendered with my mask, and she didn't know why. And I said, well, I said, well, I was misgendered at the store uh, by an older lady, and she said, well, there you go. The lady was, an old lady. I probably didn't know what was going on, and I said, yeah, but she still thought that I was a she with a mask on. Um, I don't think the doctor got what I was saying either. I was trying to tell her I got misgendered. I was wearing my mask. I believe it was because uh, from my nose on up that I looked female. I even told her I had my hair back. She still said, "Oh, it was probably just the lady uh, thinking that you were a ma'am, and because she's like 70, you said she was an old lady." I said, "Yep, I don't know. I don't know." We all want to pass. That's the thing. Um, we want to pass all the way. I mean, we don't want to just pass a little bit, right? I mean, who wants to say, "Well, I passed a little bit. That's good." Whether you're female to male, male to female, it's you want to pass, and there's things you can do to pass. Maybe like have shorter hair and have a beard. Wear men's clothes. Try to look as masculine as possible. Earrings, I don't think is the best idea when you're trying to look. And you can get on me for this if you want, but wearing diamond earrings, yes, it can. There's cis males that do it, but if you're just trying to pass and then your earrings are popping out and you're wearing lipstick or something, that's just not gonna. I don't think that's gonna work. I mean, I myself, I stopped wearing my earrings because I just think it looks too feminine for me right now with long hair and earrings. But I do like my pierced ears. Now, if I was a pirate, that would be great, because pirates wear earrings. So you wear earrings if you want. That's my opinion on earrings. I wouldn't wear real feminine-looking earrings if you're trying to pass as male. If that's your thing, if you really want to pass, you're doing everything you can to pass. But you stick those earrings in, you know. And then I saw one trans male and he was wearing lipstick and saying, I don't know why I don't pass. And I thought, dude, take the lipstick off. I mean, we might miss some old things that we used to do. We might miss the lipstick. We might miss the earrings. We might miss different things, the clothes. I've seen a lot of trans guys wear real feminine looking shirts and then say, well, I got called ma'am today. I don't think a shirt's gonna, it depends on the shirt. But if you're wearing a really bright pink flowery shirt and you're wearing earrings and you got lipstick on, I don't know why I didn't pass today. Well, maybe take a look in the mirror and see what else you can do um, to change that. Maybe reverse some of the things you're still, try to reverse some of the things you're still doing you were doing as a female. Um, I mean, maybe you could do it slowly. Like maybe it's just too quick of a change for you, and you just kind of maybe slowly taper off on some of the feminine clothes and attire and makeup. I mean, that's what I did because I was still wearing my diamond earrings, and I took them out, because I really don't want people to go, that might be a female, um, because they have long hair and they have earrings. But I personally, for myself, that's for me. I'm not gonna wear any girly earrings anymore. And I might get my hair cut shorter, but there's a lot of males. I think long hair is coming back in anyway. So even if it doesn't, I like long hair. And there are trans males that have long hair. I've seen that too. Um, I think I saw one on YouTube, but I think most everybody that I saw, other than the one guy on YouTube, I saw on Facebook. A few of trans males on Facebook with long hair. And that's up to you. And the earrings, everything's up to you. Whatever makes you feel more comfortable, do it. If that's what you want to do, is wear girly earrings, wear girly earrings. You want to wear lipstick, wear lipstick. I'm just talking about passing. The things you can do, try to do to pass. Yes, a beard does help. Of course a beard's going to help. Because if anybody has you in question and says, I don't know if that's a male or female. Oh, wait, they got a beard. They're going to say male. Unless they think you're like the bearded lady or something. Like, that woman really has a long beard. That's weird. That's not going to happen. Unless you're in the circus. so, so yeah, try to grow your beard out. Do the best, if you can. Put some minoxidil on it if it's not going as quickly as you want to. Take some biotin. I know I take biotin, and that's helped me. I believe that's helped me. Pray. If you believe in prayer, pray. Ask God to give you a nice beard to help you look more masculine. I mean, do whatever you can. Meditate. Pray. Think positive. Highlight your hair with your beard hair with mascara. I don't do that anymore. 'Cause I don't like the way it feels. Because I could use some on my mustache. It's not as thick as I want. I want a real thick mustache. You see these cis guys, and they've got a real thick beard and a real thick mustache, and that's what I want. I want my own. I want my own. It takes patience. It's been a year, and this is all I got. But maybe next year I'll have a thick mustache. I'm counting on it. Mm. So I got some hair on my arms. Show my hair. I think I tried to show you before. You can see it in both arms. So see right there. So I got a lot of hair, and then my muscles. Let's see, it'll flex for you guys. I think I'll do better than that. It's not bad. I mean, it's not the greatest. It's not like Hercules or anything. Like, I don't have great big guns, but they're bigger than they used to be. And you can gain you can gain muscle without lifting weights. I don't care what anybody says. They say, oh, you have to really work out to get muscle. No, you don't. You don't have to go to the gym and work out to get muscle. You can just do your daily routine around the house, whatever you do around the house, cleaning and just walking will give you muscle in your legs. Cis males, I know cis males that don't. They've never worked out a day in their life. I mean, maybe they tried, and they're real muscular just from having testosterone in your body. So yes, you can gain muscle without working out. You don't have to do a whole lot to get more muscle gain, but it is better to work out, of course. If you want a buff body, if you want big guns and you want pecs and all, yeah, you got to work out. But maybe at your job, maybe where you work, you lift. I don't know, wherever you work, wherever you work, maybe you lift concrete or something, or just daily lifting even. You're going to gain some muscle, more muscle than you had before. I don't care what anybody says, you're going to do that. You're going to gain some muscle. Like I said, walking, doing things around the house, your muscles will grow. If you're going to get great big um, biceps, no, probably not great big biceps, but you'll get more muscle than you had before and some more uh, muscle gain everywhere. So trust me on that. My advice is to go to the gym, swim, maybe lift some weights at home, or you could just lay on the floor and lift your legs up and do some exercise, and you're gonna gain a muscle that way. But if you're a bodybuilder and you want to work out and look like a bodybuilder, then sure, go to the gym or get a Bowflex. That's my advice, and I think I'm right. So that's my 12 months, and I need a shot today to make exactly the same amount that I would have in a year for shots. Um, but then again, like I said, I got to get with my pharmacist on that. Anything else to report? My eyes are red. Uh, I have allergies of some sort. I don't know what it is. I'm not on drugs. Like, I'm not Hunter Biden. I'm Hunter, but I'm not Hunter Biden, thank God. Um, and that's a whole different topic there if we go into politics. happy election 2020, you guys. I hope you get the guy you're voting for. I'm not gonna say who I'm voting for. It's a secret ballot anyway. I am gonna vote though, so get out and vote. Um, we're having troubled times right now, and we need the best candidate to win. As long as everybody's happy with whatever president, whoever becomes president, that's what matters. If you're happy with who, and you're getting what you want, if you want your taxes cut or raised or whatever, vote for whoever you think's gonna keep their promises. But I already know who I'm gonna vote. I know who I'm gonna vote for. So good luck with that, and good luck with this virus. Uh, it's a mess. Well, I'm going to get top surgery. Hopefully, maybe in 2 months. But because of the COVID virus, I've been postponed, which I've said before. You guys hit that subscribe, that red subscribe button if you want some updates from me. And I will show you my top surgery. I'm going to get phalloplasty, get my bottom surgery. I'm not going to show you my phalloplasty, but I will talk about it and tell you how it went. So, you guys, I want you to go out and stay safe and vote for the best candidate that you think is going to win. Should be the candidate that you want to win. Vote for your president, right? So get out, vote, wear your mask. Don't wear your mask. Wear your mask, uh, because we don't know that much about the virus right now, except for it does kill people. So wear your mask and try to pass. That's what you want to do. Try to pass. Stay safe. Hunter out. Bye.